Hello, Dr. Maddy Roth here with Roth Consulting Group. Today, I wanted to be a little sarcastic. I wanted to say thank you to insurance. I would like to thank all insurance companies because I believe they're putting us cash practices in business. With the reimbursements tanking, the quality of care for insurance-based practices is going down. People are double booking, triple booking, getting crazy, pulling someone off the streets to help them treat their patient, forcing patients to do unnecessary cardio or modalities just so they can bill and stay in business. And the consumers, the patients, are picking up on this. They know, wait, why is my therapist? Where is my therapist? They're like in the back room with two other patients. Like, I guess I'm supposed to well, I'm done with my 10 minutes on the bike. Like, what am I supposed to do? Like, I can just bike at home. Patients aren't stupid. They see the quality of care. They know the therapist is caring, but the quality is just so horrible. So I feel that these insurance companies, the reimbursement is going down. They are putting us cash practices in business because people are realizing they want quality care and they want to go to an expert that's going to spend their full time and energy and attention on the patient and help them reach their goals faster. There's not unnecessary additional visits. There's not more visits and there's not less visits. It's exactly what you need. So today I wanted to come on here and thank the insurance companies because they're really putting us in business. As you can see, more and more cash practices are popping up as it gets more normalized. It's going to be easier for us cash practices to obtain patients because it's just going to be the norm. And I see our younger patients are a lot more apt to feel comfortable paying cash. Our young moms that come in the clinic, they're used to it. Most of people's insurances don't cover physical therapy, especially if you have a good insurance, a Blue Cross, or something like that. Therapy is not covered anyway, whether you're going in or out of network. You're still paying out of pocket until you hit a deductible. So might as well go to a practice at a specialty and that you know you're going to get the result because there's proof of concept. I see some states are a little more up on it than others. I'm in one of the states that is not up to date. We're in Michigan, very insurance driven. My Ohio, Indiana friends, I'm sorry, it's tough out there. There's not a lot of cash practices. The word is not out. It's very shocking on the phone when patients hear that you're not taking their insurance. But once you get rolling, you get the reviews, you have the proof of concept, it is smooth sailing. So just hang in there for my people in certain areas of the US that this is still not considered normal. My thought is that a lot of outpatient ortho practices are going to be going out of business, and the main insurance-based clinics are going to be just hospital systems, maybe some of the larger PT, OT companies that are just cranking patients out. Those companies might survive. I feel horrible. I'm just going to say it. My friend might be listening to this podcast, but I haven't told you to your face. You own an insurance practice in our area. You're a sole provider. You're doing your best to provide quality of care. You're killing yourself. It's just really sad because I know it's a grind. It's such a grind for him. He can't hire an admin because he can't afford it. He has to look up all of the benefits for his patients, and then he sends the claims to a company that does the insurance portion for him, but then they take a decent cut of what he's making, and then he gets claims denied. And I talked to him and I said, how much on average do you think you're making per visit off of a patient? And he said, I think the average for insurance clinics, he said he didn't know actually, but he thinks is around 60 or 70 per patient. And I was like, man, that is not enough. I mean, if you have to pay a PT, if you ever want to hire a PT and you have to pay them $50 an hour, there's no money to cover overhead. It doesn't work. When I first opened my practice, I thought about taking insurance. I'm sure everyone kind of went down that rabbit hole, like, oh my gosh, like, where are the patients? Like, should I just take insurance? Okay, I'll just take Medicare, or I'll just take Blue Cross, and I'll get so many more patients. Then I realized, wow, I could at least just charge under $100 a session, $90, and I still would be making more than my insurance counterpart, where he's billing insurance, doing so much extra work, and having to send it out for someone else to do the billing for him, and then he's still not possibly getting reimbursed for patients. Then he has to deal with getting payment later and sending people to collections, and it's so much time and energy. He works about 60 hours a week, and it's just really sad. It's a sad state for the physical therapy world, because he has true, pure intentions. He loves to help people. He's really good at what he does. I refer to him all the time, but it's a grind. It's a grind, and I hate to say it, I don't know if it's going to work. I don't know if it's going to work long term if the reimbursement keeps going down. Now, he's starting to add some cash services, which I'm really excited for him about. He has like a cold plunge, and those are really smart. I think that's really smart if you are a practice and can add some cash services, maybe add a massage therapist on staff or something like that. Those can be little tricks, but really, I just think it's so tricky with insurance. So thank you to the insurance companies, because you are putting us in business. It is sad, though, for the small little ortho clinics that don't have the manpower or the budgeting or the finances to go really, really scale so they can make a little bit of profit. When I ran numbers in the pelvic health world, especially, it is not possible for us to survive as small specialty practices if we took all insurances. There's just no way. So if you have family and friends that ask, why don't you take insurance? It's annoying, because there's some undertones with that of like judgment. I feel that people are like, why isn't she taking insurance? That's stupid. Like, if she just took insurance, like, her practice would be full. But you'd be going bankrupt too. So run your numbers first before you take insurance, because if you're making 60 to 70 off a patient, and that's for a 45 to an hour session, if you're averaging 60 to 70 per patient, but in pelvic health, it's moms. Sometimes they have kids that are sick. I calculated that my OT would have to be completely full, no cancels whatsoever, 40 plus patients a week in order for us to break even. And, I'd rather her see 20 patients and for us to have that cushion and for her to chill the other 20 hours. I don't want her to be breaking her back just so we can stay in business. So think about it from your employee standpoint too. And the stress, if there's 2 cancels that week, you're down. You're not making money that week, and it's a lot of pressure. Pelvic health, we can't overlap, we can't double book. For the most part, you can get creative, But if we're really providing that quality of care, if we're doing that, I think everyone knows that just does not work well for public health. So stay the course. Let the insurance drive us into business, and don't fall down the insurance trap. I know you will regret it if you do. Run your numbers first. How much is it going to cost? How much are you going to take on or earn per session? And does it truly make sense? Or would you be better off, I don't know, lower pricing or higher pricing and just less volume, and letting your therapist have a little breather and less stress? So that's my little insurance spiel. I'm sure you guys all know all of this, but it's kind of one of those like rah, like, yeah. I think all the pelvic health cash providers can get on the same page and say, we're doing it. We're doing the right thing. We are leading the field in helping increase what PTs and OTs are making in general, because we can pay them what they're worth. And we're also leading the field in improving the skill level of our care, because we can go all out and we can have specialty trainings and dry needling and all the great things that patients want, because we have time to work with these patients and actually specialize in different things and really help them get better. So I hope you liked this little rant. If you have anything to add to it, please let me know, and I can do more podcasts on this topic if you'd like. My Instagram handle is dr.maddy_Roth. If you want to chat business, if you want to tell me about your business, I love to chat biz. My husband and my whole family is like, no, stop talking about the biz. So if you want to talk to me about the biz, it'll save my family, and love to learn more about what you're doing and learn from you. And I can share my ideas as well. Let's do this thing.